specifically for the employer is the notion that the examination room has to be where the patient is, not where the doctor is. And the work site and the home site are the most important locations to examine a patient, number one. Number two, I think what employers have forgotten is that when the patient is off getting their blood pressure taken at the doctor's office and spending 2 hours, it's not just the cost of that doctor visit that is critical. Perhaps a higher cost for them is the 2 hours that that employee has been off from work. So in effect, this becomes a win-win situation by bringing technology to the desktop. One of the ways to look at the whole issue of information acquisition and the integrity of the information is to bring in medical decision support and artificial intelligence. We use it in every other service industry. Interestingly enough, we don't use it in the healthcare industry. When I use my credit card as an example, the credit card company has a pattern of how I use that card, whether I like it or not. But fundamentally, if that pattern is disturbed, they literally immediately call me and say, Dr. Sanders, did you buy this particular item in this particular location? This doesn't fit your pattern. We can do the same thing in terms of healthcare. If you come in with a chief complaint of weakness, and I don't ask you the correct questions to get a complete information base, the diagnosis I come up with may be totally off base because I didn't think to ask the right information. First of all, the technology has to be totally intuitive. Whether it is the cell phone, which quite candidly I will predict will be the most important technology for telemedicine in the future, or whether that technology is your TV set at home, the technology needs to be intuitive. It needs to be something that you and I use on a daily basis, and this new technology or this new capability gets integrated into. Number two, the technology needs to be pervasive and integrate in with a variety of different devices. It simply becomes a plug-and-play type of capability. Number three, it needs to be commoditized and modularized, so that I don't have to buy a complete healthcare delivery system, so to speak. If I just have a dermatologic problem and the only physician I need to interface with is a dermatologist, where looking at a skin lesion is critical, I don't need a stethoscope as part of that system. I need a good digital camera. Or if I am a pulmonologist and I just need to assess the pulmonary functions of the individual, I don't need a camera. I don't need a stethoscope. I just may need a device that collects my airway resistance. So the important thing is that these are off-the-shelf type of devices, and that the costs of the technology keep going down as the volume of use goes up. Most people would probably immediately look at the whole question of the patient with a chronic illness and say, well, we're going to dramatically reduce their rehospitalization rate. We're going to significantly increase their compliance. And the answer to that is absolutely, you will. But everybody forgets about the fact that how do you become a patient with a chronic disease? Or more importantly, when do you become a patient with a chronic illness? Do you become hypertensive overnight? Do you develop insulin resistance and become diabetic overnight? Absolutely not. The majority of the time that you are ill is when, and this may sound somewhat heretical, is when you're normal. When your normal by what your physician says that you are normal. Let me give you an example. My wife walks around with a blood pressure of 90/60. And next year, she goes to the doctor and he finds that her blood pressure is 100/70. What does he tell her? He tells her, oh, Mrs. Sanders, your blood pressure is normal. And the year after that, she goes and her blood pressure is 110/75. What does he tell her? He tells her, Mrs. Sanders, your blood pressure is normal. That's absolutely incorrect. She's hypertensive for what her blood pressure is. And one of the great advantages of these technologies will to not look at us as a population base. We say a blood pressure of 120/80 is normal because that is the population spread for maybe 1 million and millions of people. But it is not your blood pressure, not your normal blood pressure. So we're going to begin with this technology to identify the beginning of the disease process, even at the time that the doctor may now be telling you that you're normal. Number one, they can dramatically enhance productivity by bringing the exam room to where the employee is, to that desktop, to that factory floor. Number two, they can significantly enhance compliance. All of the work that has been done with telemedicine has shown that the individual, the patient, compliance in taking medication is dramatically increased. When you think about the fact that we spend $100 billion a year, each year in the United States, because of non-compliance and rehospitalization, you can see both the health and the monetary dividend by being able to enhance compliance. And that is one of the great benefits of this type of technology. A child with asthma. Why in the world am I assessing their airway resistance in my office? That's not where they breathe their air 24 hours a day. It's in their home and in their school. That's where I need to be taking that measurement. And that's what telemedicine allows us to do.